Hi, this is Michelle Nyong'o with Stride Wellness, and I'm here today on Facebook Live to discuss another topic for my Wellness Wednesday segment that I have going. And if you've never joined me before, I typically cover a topic and it rotates every Wednesday. And over the last couple of weeks, I've been talking about mental health from a holistic approach. And I've been talking about it in regards to exercise, nutrition, and today I'm going to talk to you about mental health and sleep. So if you want to join for a few minutes and have a little sit down, it's probably going to take about 5 to 10 minutes to go through the topic. You can always head back to my Facebook page to watch it at a later time. I post it on my blog and also on my YouTube page, where you can subscribe and get all of the posts as they come up. So let's dive in. As I'm sure most of the general population is used to seeing people who are groggy and yawning, and I think in North America in general, we're typically overtired and we don't get enough sleep on a regular basis. And what I wanted to talk to you about today was how that can impact our mental health. So I did a little looking into the topic, and I found that in the US, about 10 to 18% of people, just in general population, struggle with sleep-related issues. And then when you look at those that are in psychiatric practice, that jumps up to 50 to 80%. So really some kind of relationship there. So there's a few points that I wanted to go over, and that was just kind of to discuss how those sleep problems, they're more likely to affect patients with psychiatric disorders more than in the general population. Hi Riss, thanks for joining. I'm just about to talk about some mental health and sleep issues. So as I mentioned, the general population is less likely to experience it than those sleep issues than those with psychiatric disorders. And those that are mostly affected or are more likely to be affected are people with depression, anxiety, attention deficit hyperactivity disorder or ADHD, and bipolar disorder. Sleep problems can also increase for developing particular mental disorders, and they can also result from those disorders. And studies have also found that treating sleep disorders can help alleviate symptoms of mental health problems. So what I wanted to go on and talk about a little bit more was how we can ultimately deal with some sleep issues, whether we have a psychiatric disorder diagnosed or whether we're just part of the general population. This can be of assistance to everybody. And there are a number of different types of sleep disorders. In fact, there's over 70. And I think that the ones that we can most commonly relate to is insomnia. So that might be in relation to having an issue of falling asleep or staying asleep. So I'm going to touch on some things that can help with both of those. So the first of which is just lifestyle change. I think a lot of us already know that caffeine can contribute to having a impact on our sleep. So avoiding caffeine use can be beneficial. Number 2 is actually alcohol. Now, alcohol is a depressant. So for some people, they find that they can fall asleep following consumption of alcohol. The thing is that it will actually wear off as you sleep. So it can mean that you would wake up within your sleep cycle. So avoiding alcohol would be best. And nicotine actually can also, it is a stimulant, so it speeds up your heart rate and thinking. So if you are somebody who engages in nicotine use, if you are not able to avoid it completely, avoiding it for a few hours prior to sleep can actually be of benefit in falling asleep and staying asleep. Physical fitness, so physical activity, and this is something that I spoke about in my first week of this little series on the holistic approach to mental health. If we can engage in regular aerobic activity, it will help us to fall asleep faster, and we can spend more time in a deeper state of sleep, and we're less likely to awaken during our sleep cycle. A big one that I want to discuss is called sleep hygiene. So this is, you can think of this as kind of like a routine and how we think about sleep. So there's a few things that you can do to really help with sleep hygiene. The first of which is sleeping in a dark room. And that might mean having to get blackout curtains if you live in an area that's got a bright street light out front of it, or if you're somebody who does shift work, which is extremely hard in and of itself on the sleep cycle. But for some, they just need a really, really dark room. So that's one option. Number two is to make sure that you have your TV and your all technology turned off within your room. And some people don't realize they just flip their phone over, and they think that that's sufficient, but actually it emits a blue light that disturbs our sleep. So setting it to a sleep mode so that it stays black and you don't have those alerts beeping or coming on in the middle of the night. That can be quite a bit of help as well. Also, having a cooler room can be of an assistance. And engaging in an actual routine, doing something on a regular basis that you can follow. So for instance, keeping your sleep bedtime routine and a morning wake up routine, if you can keep them similar, you're more likely to have a restful sleep and you're more likely to fall asleep and stay asleep. So trying to set a regular bedtime for yourself really helps. We do it for our children, but we oftentimes don't do it for ourselves. And a wake up time. So if you can set an alarm, even on the weekends, I know we like to sleep in, but that can actually be disruptive. So if you can kind of set something to make sure that you're going to bed and waking up at the same time. Also, keeping the bedroom for bedroom activities, which means that you would keep your bedroom for only sleeping and sex. So you would not be using that for reading a book or for, which I love to do. I'm terrible. I love to read in bed and I love to just lay in my bed. But if you could do that actually on your couch or elsewhere, same thing with watching TV, because your brain doesn't then associate it with going to sleep. So if you can even institute like maybe having a shower before bed or, doing similar activities leading up to bedtime, it starts to cue our body to alert us to the fact that now it's time to go to sleep. All right. Additionally, another one that can be of help is relaxation techniques. So engaging in some deep breathing, engaging in full body, you can engage in some tension and then release techniques that can help your body to just relax. Those can be provided. You can find those on the internet. I have some if you're interested in them, and seek me out and I can provide those to you as well. A few that help. Some people like to listen to music. I know my daughter Maya, she has a sleep playlist that she plays, and she says that basically it's just conditioned her body to start to go to sleep. So as soon as she puts her headphones on and she turns it on, before this first song's even done, she just falls asleep. And that's just something that she's taught herself how to do. And so those are some things that you may want to try. I heard a tip from somebody who I worked with who struggled with insomnia, and his main issue was falling asleep. And he would ruminate about how much sleep he was going to get, about him not falling asleep. And oh my goodness, if I fall asleep now, I think we've all done this. If I sleep now, I'm going to get 3 hours. And if I sleep now, I'm going to get 2 hours and 45 minutes. And you count down. And sometimes we do this because we're fearful of forgetting something or missing, an alarm, that kind of thing. So keeping a pen and paper beside your bed to quickly jot down things that you need to remember in the morning so you don't have to worry about them while you sleep, or maybe journaling so that you can release some of the stuff that's staying within your, your thoughts, that you can just put them away and then, plan to address them when you pick up the journal or the writing the next day. But one thing that he did that he found worked super well was that he gave himself 15 minutes. So he'd just try to go to sleep. And if 15 minutes passed, he'd get up and he'd have a little routine and he'd quickly do it again, because he was just so afraid that he was going to lay awake all night. And so he broke that by getting up and then starting again. So he was actually never laying there for more than 15 minutes. And for him, that helped. So if you can find a little trick like that, that would work. Excellent. There's something that you can do with a counselor or a therapist, a psychologist, called cognitive behavioral therapy. And it tends to help people with insomnia-like conditions because they can become preoccupied with not falling asleep. And through CBT, the cognitive behavioral therapy, you can learn some techniques to help change your negative expectations about not falling asleep or about sleeping in general. And you can build more confidence and hopefully in turn have a better night's sleep. And these techniques can also change, the way that we attribute or blame our personal problems on our lack of sleep the night before. So there's quite a few options there. Additionally, there are also medication options. I'm not going to go over those here. You could seek out a doctor or a professional who's able to prescribe medication, and those can be of assistance as well. And those can help with falling asleep, and for some people they can also help with staying asleep. Additionally, those who may be on some form of medication for another disorder, that may be the reason for your sleep issue. If that's the case, that's something that you do want to talk to your health practitioner about to see if you can adjust it, or maybe change medications, or find another technique or way to help so that you don't have that side effect, because it really can impact our day-to-day living and ultimately our mental health. So that's all my time today for Wellness Wednesday. If you liked the video today, please like it on my Facebook page. You can comment if you have any questions or any ideas for a future Wellness Wednesday, or share it with somebody that you know and love that may be struggling with some form of a sleep issue. I'll also be posting this, as I said before, on my blog. You can go check it out there. It's www.stridewellness.org. Excuse me. And I'll also have it on my YouTube channel. And I'd love for you if you went over and checked it out. I keep everything over there, and you can subscribe. I stay regularly on Facebook and Twitter by, I try to engage with people on there and post regularly on Twitter some awesome articles and threads. And you can find me there at Wellness Stride. So it's backwards and there's 3 S's in the middle. I hope you enjoyed this week's segment. I look forward to some feedback. And until my next segment, take care and be well.